Hi, I'm David Klein. I'm an orthopedic surgeon at Kennedy White Orthopedics in Sarasota, Florida. In this orthopedic moment, I wanted to talk to you about distal radius fractures, otherwise colloquially known as wrist fractures. It's kind of a misnomer because really the wrist is not the forearm bone, but the bones beyond the forearm. The wrist is what allows you to move back and forth. When most people say wrist fracture, they're talking about a distal radius fracture. The radius is the larger of the two forearm bones that support the hand, and usually it's a fracture at this location. These fractures have all different classes and occur both in adults and children. It's definitely one of the more common things to happen if you fall forwards onto an outstretched arm. Some distal radius fractures are non-displaced. A non-displaced fracture is basically like a crack in a teacup in the sense that you could still drink out of the teacup without spilling any tea. These type of fractures are frequently just treated in a brace or a splint. Some of these fractures are impacted or mildly angulated, and depending upon whether they have a significant change to the position of the wrist, they may also just be treated in a splint, a brace, or a cast. Other of these fractures are displaced, where the pieces are shifted out of position and need to be put back in position. For those type of fractures, they can be treated sometimes in casts, and sometimes they require surgery. Common methods for surgery include what is known as closed reduction and pin fixation, where the pieces are put back into alignment and held with temporary wires that hold the bones in position and are taken out later, or plate and screw fixation, which is where the pieces are lined up and held with a plate, usually on the palm side of the wrist now, but sometimes on the back side of the wrist. In these cases, the plate is usually left in place permanently, both to stabilize the fracture until it heals, and then because the plate usually doesn't cause any problems, we don't have to go in and take it out. Sometimes people do have symptoms or some problem that we take the plate out for, but that's less common than not. Typically, in an adult, a wrist fracture or distal radius fracture will take about 6 weeks for the bone to actually grow together and start knitting together. The actual time for complete and total healing is about 2 years, but most people feel significantly better in the first 4 to 6 weeks, and that's when stability is regained. Strengthening is something that may take longer, and you will have to ask your orthopedic surgeon as to when you can start playing sports, lifting weights, and doing other activities. One thing that my patients have to be encouraged to do is to move their fingers. If you don't move your fingers and make a tight fist and fully extend them, you may get stiffness that may last for weeks to months. And generally, with most wrist fractures, it's okay to move your fingers. I would still ask your orthopedic surgeon about that. There are some other problems that can happen depending upon the type of fracture, stability or instability. Sometimes we treat people with splints after their surgery. Sometimes we splint or cast them above the elbow. That depends on the situation and the type of fracture. Once again, I would tell you that you need to speak to your orthopedic surgeon. Overall, wrist fractures can be treated in many ways and have different levels of outcome, so the treatments often will be dictated by what type of outcome the patient is expecting. A wrist fracture is something that you should see your orthopedic surgeon for, and it usually takes x-rays and sometimes other images such as an MRI or a CAT scan to find out more details about, which may or may not change treatment. Thanks for listening to this orthopedic moment.